Racial disparities in labor and delivery. Did you know that Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women? In the last 30 years, these issues have become even more severe. Racial disparities in labor and delivery are a huge problem in the United States. Multiple factors such as lack of access to healthcare, economic opportunity, systematic racism, and education contribute to these issues. According to the CDC, over 80% of pregnancy-related deaths are preventable with proper care and interventions. Ever since becoming pregnant, I've made it my duty to educate myself on all things regarding fetal development, labor, and delivery. As a woman myself, I find it is important to educate others on the racial disparities in our country. Today, I'd like to share the ways we can help prevent racial disparities in labor and delivery and lower the number of maternal mortalities in the United States. It is not only the health system that faults us in these times, but our total lack of education in pregnancy-related topics as well as our social and economic shortcomings. It is important that I share why minorities in America face these injustices. Understanding why these racial injustices exist will help us better prevent them as a society. As I mentioned before, there are many factors that attribute to the high number of maternal mortalities in minority women than white women, one of them being access to pregnancy-related care. Receiving late from third trimester forward or no prenatal care at all can highly increase the risk of pregnancy complications, like premature birth, low birth rate, stillbirth, birth defects, preeclampsia, gestational diabetes, and more that, if left untreated, could result in the death of both mother and baby. A study done by the National Center for Chronic Disease Prevention and Health Promotion shows that compared to white women, Native Hawaiian Pacific Islander women are 4 times more likely to receive late or no prenatal care, while Black women are twice as likely to give birth with late or no prenatal care. This typically stems from economic opportunity and cultural beliefs. Women living in low-income areas have a harder time accessing health care as well as health insurance to cover these visits. This includes teen mothers, who, as research shows, are higher in minority women. Limiting affordable health care in America has highly impacted the majority of our country and is a large reason why so many women experience severe pregnancy-related complications, sometimes leading to death. Another issue relating to the high number of pregnancy-related issues in minority women is the genetic disorders that are passed down through women of different ethnic backgrounds. According to the National Library of Medicine, Black women are more likely to have pre-existing cardiovascular morbidity that increases the risk of maternal mortality. Second, Black women are more likely to experience adverse pregnancy outcomes, which puts them at risk for long-term cardiovascular disease. With these underlying conditions and statistics, also including chronic heart disease, obesity, hypertension, and diabetes, it is even more important that Black women receive the care they need and are educated about the outcomes of their possible health conditions and the ways to prevent them. Today, it does not feel like a priority in our society to normalize educating young women on their bodies, genetic makeups, and how to receive the potentially life-saving care they need. There are multiple medical journals that have completed polls comparing how Black patients were cared for and treated during prenatal appointments and labor compared to white women. With the systematic racism in the medical field, many women of color feel unsafe in the medical environment and feel they cannot trust medical staff to make the best choices for them and their babies. This leads to women ultimately feeling safer, either neglecting prenatal appointments in general or seeking out holistic and natural birth methods, which do not treat any potential or pre-existing health issues. While all methods of birth are beautiful and can be safe, it is important for all women to check with a doctor or physician at some point during pregnancy, regardless of if they plan to have a holistic birth or medical. While medical staff will deny claims of the mistreatment of minority patients, the proof is in the pudding. Minority women do not feel safe advocating for themselves or speaking out at appointments, and this unfortunately contributes to the rise we've seen in maternal mortalities in the last 30 years. The rise of maternal mortality rate in women of color have raised concern in many people of power who are committed to addressing this issue. So what can we do to help? There are several suggested ways to help lower the rate of mortality in pregnant women. According to the Mayo Clinic, it is important to get support from family and friends, as well as advocating for and making this crisis known to society and the people around us. Many people are very uneducated on pregnancy in general, so it is important for people to understand safe sex and safe methods of birth control, fetal development, and labor, as well as the large issue of maternal mortality. Pregnant and postpartum women need to ensure they are educated on their own body and the changes it will go through, as well as potential genetic disorders they may have. All women need to know the urgent maternal warning signs and get help immediately rather than delaying help. In advocating for women in the United States, I feel that it is important to push public schools to start educating students on all aspects of pregnancy I mentioned before. Women's health needs to be taken seriously and embedded in the brains of Americans from an early age, as knowledge is power. Another way to address this issue is to ensure that healthcare professionals are trained and understand the higher risk for women of color in pregnancy, as well as listening to patient concerns equally. There is not physical evidence that there is racism in the medical community, but there have been multiple reports of Black chemo patients not getting the same treatment as their white counterparts on the same pain level. Similar situations have been recorded in women's health and in pediatrics. Many hospitals and healthcare systems have made it their duty to end this crisis, making multiple positive changes, including mandatory bias training to promote cultural education, as well as extending postpartum care coverage to after 6 weeks. Maternal mortality does not just take place in the delivery, but up to a year postpartum. Postpartum health complications and severe mental health issues like PPD add to this crisis as well. Women are not just bodies to bear children, but people and souls too. Women deserve more than basic treatments for going through such a traumatic yet beautiful experience of bringing another life into the world. Although there are many positive changes taking place on a social and government level, it is important to continue advocating for minority women and making change to our healthcare system. After sharing information on the racial disparities in labor and delivery and how we can fight this, I'd like to leave you with one last thought. Maternal health remains a staggering challenge, particularly in the developing world. Globally, women die in complications from birth every single minute. Jessica Capshaw.